This video is one video in a series of 3 videos developed by the Arizona Center for Disability Law. The acronym is ACDL, through a grant from the Arizona Commission for the Deaf and Hard of Hearing, ACDHH. This video addresses frequent and important questions about the rights of people who are deaf and whose first and primary language is American Sign Language, ASL, to a sign language interpreter in healthcare communications under the Americans with Disability Act, ADA. The second video will address remote interpreting versus on-site interpreting. The third video explains the complaint options under the ADA when a healthcare provider fails to provide effective communication. These videos are made available by ACDL and its legal staff for educational purposes to give you general information about the ADA, not to provide specific legal advice. By viewing these videos, you understand that there is no attorney-client relationship between you and ACDL. The information in these videos should not be used as a substitute for competent legal advice from a licensed professional attorney in your state. Neither actor in the video are attorneys. I'm deaf, and ASL is my first language. English is my second language, and I'm not as proficient in reading and writing English because it is my second language. I need a sign language interpreter for important healthcare information. I feel like people like me experience discrimination by healthcare providers. I have some questions about the Americans with Disability Act and communication between people who are deaf and their healthcare providers. I understand. Let's get started. Okay? If a healthcare provider is meeting with a deaf patient like me to discuss their health conditions, test results, treatment options, and possibly surgery, doesn't the ADA require that they provide a qualified interpreter for these communications? That is a good question. A qualified interpreter should be available to interpret for people who are deaf and whose first and primary language is American Sign Language, ASL, when necessary to provide effective communication. Generally, healthcare communication involving lengthy, important, or complex information requires a qualified interpreter for people who are deaf and communicate in sign language. According to the U.S. Department of Justice, that enforces the ADA, the following are important and complex healthcare communications: discussing a patient's symptoms and medical condition, medications and medical history, explaining medical conditions, treatment options, tests, medications, surgery, and other procedures, providing a diagnosis and recommendation for treatments, communicating with the patient during treatment, testing procedures, and during physician's rounds or during office visits, obtaining informed consent for treatment, providing instructions for medications, pre- and post-treatment activities and follow-up treatments, providing mental health services, including group or individual counseling for patients and family members, providing information about blood or organ donations, discussing powers of attorney, living wills, and/or complex billing and insurance matters. During educational presentations, such as birthing or new parent classes, nutrition and weight management programs, and CPR and first aid training. While this includes many examples, there may be other important, lengthy, or complex healthcare communication that requires a sign language interpreter for effective communication. But doesn't the ADA require that healthcare professionals provide a qualified interpreter for all healthcare visits with a patient who is deaf and prefers a qualified interpreter? There may be some straightforward and simple communications where writing notes provide effective communication. If you came into a doctor's office to pay a bill or get a copy of your child's immunization to produce to the school, these documentations might be easily handled by writing notes. Use the DOJ's list of important and complex healthcare communications as a guide. If the communication is one or like one of the healthcare communications on that list, a qualified interpreter will be necessary for communications between a healthcare professional and a patient who is deaf and communicates in ASL. For other communications, consider whether you can accomplish the communication with a few quick, short notes. So you mentioned effective communication. What does effective communication mean? The U.S. Department of Justice, DOJ, published guidance describing what effective communication means. The purpose of the ADA's effective communication rules is to ensure that people with a vision, hearing, or speech disability can communicate with, receive information from, and convey information to private businesses and state and local government agencies. Covered businesses and government agencies must provide auxiliary aids and services when needed to communicate effectively with people who have communication disabilities. Auxiliary aids and services include qualified interpreters and video phones. In determining when a sign language interpreter is required or some other auxiliary aid or service, healthcare providers should look at 3 factors: the length, complexity, and context of the conversation. When healthcare professionals are evaluating what would be effective, they will have to look at each individual patient because each patient may require different auxiliary aids and services. Many healthcare providers assume people who are deaf can read lips or expect us to communicate by writing notes. Can healthcare providers refuse to provide a qualified interpreter and expect me to read lips rather than provide qualified interpreters at appointments and visits? The ADA requires effective communication, and effective communication for important or complex healthcare communication with people who are deaf and whose first and primary language is ASL means a qualified interpreter. For many reasons, lip reading rarely results in effective communication for people who are deaf and communicate in sign language. First, many English words sound the same but have different meanings. Second, many sounds cannot be understood by lip reading. Third, there are physical factors that can further reduce the effectiveness of lip reading, including whether the speaker has a mustache or a beard, speaks with an accent, mumbles, or in many healthcare situations is wearing a mask. Finally, it's difficult for people to recognize unfamiliar words when lip reading and healthcare communication often involve unfamiliar medical terms and prescription drug names. Writing notes is ineffective because healthcare professionals are in a hurry and it takes longer to write information than it does to speak it. That means when writing notes, healthcare workers may inadvertently provide less information to patients who are deaf. And let's face it, since English is a second language for people who are deaf, it is difficult to communicate about important, complex information in a second language. It is tiring and lead to miscommunication. Also, when sign language interpreters are translating the communication, they are judging whether effective communication is taking place, and if not, asking for important opportunity to clarify communication. Does the ADA and effective communication rules apply to all types of healthcare providers? The ADA applies to most healthcare providers. Only religious entities are exempt from the ADA. However, if the religious entity accepts federal funds like Medicare, then Section 504 of the Rehabilitation Act would apply. Section 504 states that an individual with a disability cannot be denied the benefits of being excluded from participation in or otherwise be subjected to discrimination under any area covered by the 504. In other words, healthcare offices ran by religious entities can be held liable for discriminating against individuals with disabilities. Some healthcare providers, such as physical therapy offices, say that they are not the type of facility covered by ADA. Are all types of healthcare providers covered by the ADA? Yes. All types of healthcare professional offices and hospitals are covered by disability discrimination laws. Title II of the ADA applies to all programs, services, and activities of state or local government, including healthcare services. Title III of the ADA applies to professional offices of any healthcare professional, hospitals, and other service establishments. Section 504 of the Rehabilitation Act applies to all recipients of federal financial assistance. This means that most healthcare settings will be covered. This includes, for example, physical therapy, speech therapy, occupational therapy, hospitals, registered nutritionists, dermatology offices, chiropractors, radiology services, labs, pain management centers, psychiatric offices, professional counseling services, acupuncturists, behavioral health services, and others. Some healthcare providers tell me that they have less than 15 employees and the ADA does not apply to them. Is that right? That may be confusing, that rule with a different part of the ADA. Title I of the ADA, which covers employment, covers employers with 15 or more employees. This limitation does not apply to Title II of the ADA, which covers state and local government healthcare providers such as Access, ALTCS, and regional behavioral health authorities. Nor does this limitation apply to Title III, which covers private businesses open to the public, such as Banner, Mayo Clinic, and Abrazo Healthcare. So, the bottom line is private and public health care providers are covered by the ADA and must provide effective communication, including sign language interpreters when necessary. How can I explain to my healthcare professionals why I need a sign language interpreter for important or complex healthcare communications? They don't get it. Healthcare professionals who do not provide sign language interpreters for important or complex healthcare information likely don't understand deafness, the difference between American Sign Language and English, and why lip reading and writing notes are ineffective methods of communication. Unfortunately, it is difficult to educate healthcare professionals when you don't have a sign language interpreter to convey this important and complex information. To help you educate your healthcare professional, ACDL has drafted an open letter to healthcare professionals that you can use to educate your doctor, healthcare office, hospital, or therapist. This letter also explains reasons why denying effective communication results in unequal healthcare services. As you know, but some healthcare professionals take for granted when communicating with patients who are deaf. Effective communication is important because it will shape how you make important healthcare-related decisions. Without effective communication, there can be no informed consent. Informed consent is when the doctor gives you enough information about a treatment, procedure, or medication so that you will have enough information to consent. Second, you should be given the opportunity to discuss all your important medical questions. For example, if you were to go to your doctor for a serious ear infection and your doctor prescribes medication, you should be able to ask questions about side effects. How long should take the medication and what to do if your symptoms get worse. Finally, without effective communication, your doctor runs the risk of not understanding your symptoms and may misdiagnose, overprescribe prescriptions, underprescribe prescriptions, or make some other grave error that could negatively impact your treatment or cause you harm. If you would like to use this letter to educate your healthcare professionals, please click here on ACDL's website. Many healthcare offices and hospitals will ask family or friends who are accompanying deaf individuals to the appointment to translate. Can healthcare providers rely upon companions to interpret during the appointment? In most cases, a healthcare provider may not rely upon a companion to act as an interpreter. There are two exceptions. Let me explain the ADA's general rule about companions and the two exceptions. The ADA's effective communication rules apply to companions. Companions are any family member, friend, or associate of a person seeking or receiving healthcare services. You are right that in the past, many healthcare providers expected a person who communicates in sign language to bring a family member or friend to interpret for him or her. Companions, especially children, often lack the impartiality and specialized vocabulary needed to interpret effectively and accurately. However, the ADA places responsibility for providing effective communication, including the use of qualified interpreters, on healthcare providers. They cannot require people to bring someone to interpret for them. That is the general rule. Here are the two exceptions. In an emergency where there is an imminent threat to the safety or welfare of an individual in the public, then an adult or minor child accompanying a person who uses sign language may be relied upon to interpret or facilitate communication only when a qualified interpreter is not available. In situations not involving an imminent threat, an adult accompanying someone who uses sign language may be relied upon to interpret if the individual requests this arrangement, the accompanying adult agrees, and reliance on the accompanying adult is appropriate under the circumstances. This exception does not apply to minor children. In a non-emergency, healthcare providers may not rely on an accompanying adult to interpret when there is reason to doubt the person's impartiality or effectiveness. Many healthcare providers say it is too expensive to provide a qualified interpreter because the cost of the interpreter will be more than they can bill my insurance. The ADA doesn't allow them to deny a qualified interpreter to people who are deaf, does it? The healthcare provider can only refuse to provide effective communication, such as provide a qualified interpreter, if the cause would pose an undue burden. However, this defense rarely applies to most healthcare providers because of their overall resources. The ADA states that it's the responsibility of the healthcare provider to pay for the interpreter. The doctor must pay for the cost of an interpreter, even if the cost of the interpreter is more than the cost of the visit. The doctor is expected to handle the cost of the interpreter as a normal business expense or as part of the overhead cost of operating a business, unless it would be a significant and burdensome expense in light of the provider's overall budget and resources. Some healthcare providers bring in a staff person to interpret who is not proficient in sign language. That's not good enough, is it? The interpreter must be qualified to translate the appropriate medical terminology accurately and impartially. If the healthcare provider is using a staff person who is not qualified to translate accurately and impartially, then they are not providing effective communication. Some healthcare providers pay for a qualified interpreter for patients, but when the deaf individual is a companion, such as a spouse, parent, or caregiver, does the ADA only apply to the patients? No, the ADA applies to companions as well. For example, if a doctor offers programs such as a prenatal class for expecting parents, then the doctor will be required to provide effective communication for a father who is deaf, even if the pregnant mother is not. For example, for parents or guardians who are deaf, your child's doctor will be required to provide effective communication so that you can effectively participate in healthcare discussions concerning your child. Or if a friend is deaf and will be providing the caregiving after discharge from a hospital, the hospital will need to provide a qualified interpreter for the communications related to discharge instructions and post-hospitalization care.